1 year later, Dr. Kyung was in Brazil to take a lecture about the KILBON system, and then he showed your appliance, and it became very interesting to understand details about all the process. So I decided to come here again to visit his office to see how the step by step about the KILBON system. Before, maybe 2 or 3 years ago, I read some articles about this system, and I become very interested, invite him to go to Brazil to explain us about this one, and that's why I'm here. Oh yes, of course. I think it's today it's the best way to work with class 2 gum smile patients. To treat these patients, the probably KILBON system is the best appliance for do it. That's why I intended to start to do it in Brazil right now. The completely torque control when you do the retraction of upper tooth. Because when you do it using lingual side of the tooth, it's very difficult to control this torque. And then when you use KILBON system, you have control in all the fields. So that's why I think it's a very, very good appliance to be used in that situation. Oh, I have been there 2 times, and I spend all day long there to see laboratory procedures, to see PowerPoint presentations, to see clinical cases, to see the the patients, and it was very good to visit the clinic, Central Clinic. Yes, I think I start to use it next month. Probably I start to use because, as I told you, in my lingual patients, I think it's very difficult to control the retraction of the anterior teeth, and then when you use this kind of appliance, you can have this control. So now I understand more about the laboratory procedures, and I think I can start to do it right now. Oh, they were very interesting about this approach, but the idea is, as I am here to learn more about this philosophy, when I return to Brazil, I will start to explain them about this one, and then if I have maybe we will invite Dr. Kyung again to complete our teaching about the KILBON system to our Brazilian friends. Yes, this is the idea. Our idea is, as we started to show them in many different states in Brazil, many different universities there, about this system, most orthodontists will start to use this appliance. Yes, Brazilian is the #1 in the world regarding about aesthetic. Everything related to aesthetic, Brazilian wants to try. So talking specifically about orthodontics, I use lingual orthodontics mainly because aesthetic proposed. And then KILBON is a good aesthetic appliance too. So I think in many cases, and you need to retract the anterior teeth using aesthetic appliance, this is our appliance. Yesterday, I was with Dr. Kyung talking about this topic. We think the future will be using not manual appliance, many devices will be we need to use as a CAD/CAM service. So that's why I think the next step for KILBON must be the CAD/CAM, using CAD/CAM service, and then this is the future for all orthodontics, all of us, and in the world, not only in Brazil or here in Korea, but around the world. This is the future for me. Yes, yes, customization can be the word for the future, and including in a next step, because today we use a customized orthodontic appliance, but in the future I think we must use each one of us will have your own customized bracket. You choose the right bracket for your patient for that case. That's what I think about this.